Alrighty, so today for this video we got 3 tests coming at you. We're going to have the posterior glide at 90 jerk test and the posterior glide at 0. So the first test we're going to start with, we're going to have our patient laying on their back, supine. We're going to need our testing hands, and then we're going to have patient up here like this. And so we're going to feel on the posterior back side of their shoulder. You can do your spot sign if you can. And your hands are going to pretty much be here for all the tests. You're going to be feeling the glenoid, and then on the humerus, and you have the joint line right in between your fingers. That's where you want to make that Spock sign. And so for the 90, we are just going to apply a force downward like that, just feeling for any sliding, clicking, or popping. Wash your face to see apprehension. And all these tests are testing posterior instability. So we can do our posterior glide at 90, and then we'll move right into the jerk test. So the jerk test is just going to be applying that pressure and sliding them across like this, and then coming back, looking for a jerk, which would be kind of like a popping. It's going to be that humerus popping out of the glenoid, and then when it goes into horizontal adduction, and when it comes back, it's going to popping back into the shoulder joint there. So once you see a jerk, you know a jerk. And so the next one we're going to do here is posterior glide at 0 here. And so just stick your hand in your armpit here. Hopefully you're not too sweaty. You put on some good deodorant. And then we're going to, once again, have our hand spocking behind them. And then we're going to grab their arm here, and we're just going to apply a downward force like that, feeling for that any sort of clicking or popping, kind of a dislocating laxity, or we can wash their face to see if they have any apprehension, which would be a positive sign. And once again, all these tests are testing for posterior instability of the shoulder joint. Cheers.